Hello, so for my integrative health package, I will be talking about the condition called urinary tract infections, also called UTIs. Basically, this infection is the result of a bacteria called E. coli. And E. coli can be contracted through many different avenues, such as even from a high sugar diet, from pregnancy, sexual intercourse, vaginal products, spermicides, many different ways. Even women have to be mindful of how they wipe after using the washroom. We need to wipe from front to back and not back to front, or else we are spreading bacteria from our anus into the urethra, which can then result in a UTI. So because of this, women are more likely to be affected by UTIs, just because of how close everything is together in our female genitalia compared to men. However, men still can get a urinary tract infection. Basically, the lining of the bladder is very smooth and glass-like, so if E. coli is present, it's easy for the bacteria to bind on and to claw at the bladder, which will then result in many uncomfortable symptoms, such as burning on urination, increased urgency, cloudy urine, a foul smell, and sometimes even blood in our urine. So in biomedicine, there is a test that is taken. It's called a urinalysis, which tests the nitrates and the leukocytes in the urine, which will then confirm or deny if a UTI is present, but as well as it will test to see which bacteria is the culprit. Oftentimes it's E. coli, but there are many different bacteria that can cause a UTI infection. So based on these results, then the doctor will then decide what pharmaceutical medication to prescribe the patient. A well-known pharmaceutical drug is trimethoprim, which kills the bacteria by stopping the bacteria that's already in the bladder from producing more folic acid. If no folic acid is present, then they can't continue to rebirth. Another pharmaceutical is called phosphomycin, which is a bacterial antibiotic which interferes with the cell wall synthesis in both gram-positive and gram-negative bacteria. So this one's a little bit more stronger than the previous one that I mentioned, and it actually just stops any kind of bacteria from binding onto the cell wall in the bladder. This also can be treated with herbal medicine, and if this was my client, I would have them go on organic juices, a tincture taken 3 times a day at 5 ml, as well as a tea. And the primary focus of the treatment would be to help the body flush out toxins through a diuretic action. So for the juices, I would recommend the client to purchase organic, unsweetened, and not from concentrate cranberry juice. Because cranberry juice is high in proanthocyanidin, which will prevent the bacteria from binding onto the bladder lining, and then the bladder will be able to get flushed out through the urine. If the client cannot tolerate cranberry juice, then I would recommend them to incorporate freshly pressed organic parsley, cucumber, or celery juice, as those 3 that I just mentioned are diuretics and might help make the cranberry taste a little bit more tolerable. The other botanicals that I would add in a tincture and a tea would be Taxicum officinale, which is dandelion leaf, for its diuretic action and to help cleanse the bladder. I would also add urzi, which is bearberry, for its diuretic and urinary antiseptic, especially if E. coli is present. So this one I would definitely add in for E. coli that's present in the urinary tract infection. I would incorporate Zayamaze, which is corn silk, for its demulcent action, and because it helps to soothe and heal the tissue, which will reduce the amount of inflammation and irritation that happens when a UTI is present. Next, I would add Althea, which is marshmallow root, for its demulcent action, and also because it increases the acidity of the urine, which will inhibit any future growth from occurring. Now, if there's blood in the urine, I would also add Plantago major and Alchemea mellifolium, which is plantain leaf, and yarrow, because both these herbs are septic, so if there is bleeding, it will stop the bleeding from occurring. For nutritional considerations, it is important for the client to make sure they're having adequate liquids, especially like plain water with lemon, because the lemon will also help to cleanse. And also to avoid things like caffeine, chocolate, sugar, and any refined carbs. And lastly, just to incorporate whole organic foods into the diet. And lastly, especially if this is a reoccurring problem for the client, I would recommend them to just take a second or a few seconds to reflect on their lifestyle, their environment which they live in, and any social atmospheres they find themselves in, and to ask themselves how they can improve in each area that will serve their higher purpose in terms of their health mentally, physically, and emotionally, because oftentimes physical ailments are the result of internal emotional ailments, which then manifests into a physical condition. So I would definitely have them reflect on that question. Thank you so much for taking the time to view this video, and I hope to see you soon.